Well, hello, everyone. I am Tracy Gonzalez-Padron, the director of the Daniels Fund Ethics Initiative Collegiate Program at UCCS College of Business. And this roundtable offers us the opportunity to hear how our fellows are able to teach ethics and implement principle-based ethics in their work area or area of expertise. It is my pleasure to introduce Paige Whitney, a UCCS Ethics Fellow. And Paige is also currently the director of the UCCS Health Circle Center for Active Living and a clinical instructor in the Helen and Arthur E. Johnson College of Nursing and Health Sciences. This position, as her description on the Center for Active Living states, allows her the opportunity to work with dynamic professional teams to develop, implement, and sustain innovative health and wellness programs for the Colorado Springs community, but while also providing students hands-on experience and training in the field of health promotion. So I will let Paige begin talking about ethics, a catalyst for interprofessional education and teamwork. Thank you.
Well, thank you, Tracy, for the introduction. And thank you, everybody, for taking time out of your day to listen to this presentation and learn a little bit about how ethics can be a catalyst for interprofessional education. And so I see that we have a large contingent from Bethel, which is great. And so it helps us situate the information, but I also want to be mindful of those others that are here from other institutions as well as other departments. So I really want this to be a collaborative conversation. So as you have questions, please go ahead, unmute yourself, ask the question as they come up or put them in the chat. Because I would really like this to be a collaborative effort, as that is what we're promoting here. So today's presentation has three main goals. First, I would like to briefly identify what interprofessional education is, why it's important. And then second, I would like to talk a little bit more about how myself, as well as a team of other faculty, work together to implement an ethics-based case scenario into a current interprofessional education class. And then finally, we'll talk a little bit about the outcomes of the impact and what are some next steps to consider. So with that, I'm going to fast forward a little bit. I want you all to take a look at this cartoon here. Feel free again to unmute or put in the chat, what do you see and how might this relate to you either personally and or professionally?
I can jump in real quick.
Yeah.
What I see right here, the first thing I see is a bunch of different healthcare services in different locations. So that means maybe a bunch of different appointments.
Yeah, absolutely. Being overwhelmed, says Sean. Yes, thank you, Sean. I would agree. And so, Gina, I think you absolutely hit it on the nail. Margie, the silos is absolutely true. And so something that we illuminate through the research around interprofessional education is the traditional models for healthcare have a tendency to train our future workforce in these silos to make sure that they're prepared, right? There are a lot of important skills to have, but yet there's a lack of collaboration. And we know that health is very complex. And there's a lot of things that need to go into this and a lot of different perspectives that need to be taken into consideration when looking at the client, the community, and or population in which we're serving. And so that predicates the reason as to why interprofessional education is something that we need to explore and perhaps promote within the higher education as well as in our healthcare system. So moving along, interprofessional education, especially those of you in Bethel, you have heard this term, operationally defined. Interprofessional education is when students from two or more disciplines are working and learning together to create and come up with solutions to complex scenarios. And so oftentimes this is in a healthcare setting. But for those of you that aren't healthcare related, it doesn't always have to be healthcare related. But really what interprofessional education does is promotes the opportunity for students to learn together so that they're better prepared to collaborate in different spaces. And what I want to highlight here is that interprofessional collaboration, which is the result of education, is the fact that it doesn't need to be in a clinical setting. So oftentimes in our mental models or our paradigms, we think about interprofessional education or collaboration happening in a clinical setting with doctors, nurses, physical therapists, occupational therapists. That's kind of a traditional mental model. But what I want you to take away today is that these models don't necessarily just occur in a clinical setting. We can have them in community settings. We can have them in corporate settings, campus settings, and there are a variety of others. And so I want to pause here for a moment. Feel free to unmute or chat, or just simply think about the different disciplines that you may work with in this kind of way, whether or not it's interdisciplinary or interprofessionally. So take a moment and think about that. And what setting does it occur? Is it clinically? Is it community, corporate, campus? I know in the respect to Bethel, there's a lot of different settings in which interprofessional education and collaboration can occur. And so why is interprofessional education important? The main reason is that there's been a call, especially from healthcare providers and those that are educating the future workforce, that interprofessional education be embedded within the accreditation factors for these different disciplines. So looking at Bethel specifically, nursing, athletic training, and nutrition all have accreditation factors that need to include interprofessional education. And that's because the idea of the quadruple aim is there. And the quadruple aim showcases best practice for health outcomes. And so really what the quadruple aim is doing is shifting that paradigm around from these siloed healthcare providers all working separately to help a client in the middle or a community or a population, but shifting that so that these teams and these different disciplines work together, build their strengths to help keep the client, the community, and or population at the center of care. And you can see through this Venn diagram that the outcomes that result from that are improved population health, which is a positive, reduced healthcare costs, which we all can acknowledge is something needed, but also the satisfaction of providers. A lot of the literature today highlights the burnout rates of providers. And would that change if we work together interprofessionally with a shared decision-making model to help provide the best quality of care for our clients, our communities, and our populations? And so that's the paradigm shift that has predicated the importance of interprofessional education and why these healthcare organizations, specifically within the academic area, have implemented this into their accreditation standards. So talking a little bit more about IPE, why is this important? What are students gaining from it? A lot of it is that these collaborations stimulate more collaborative care. So as students translate or transition away from their education into the environment in which they'll be working, they're more ready to ask those questions, to engage other professions so that they can collaboratively look at clients and or communities or populations in whatever way in which you serve them. It also helps to improve healthcare outcomes. It creates shared mental models. Oftentimes we're trained in different ways in which we think differently, but bringing those together can be a positive because those mental models then can be created into one. It also reduces hierarchies that can exist. So a common example with this is that, we have the doctors or physicians working with a nurse, and oftentimes there can be these power imbalances that exist. And so by training students in an interprofessional setting, we actually create a shared leadership model where different professions are going to rise at different times versus always having one person at the top, which is important so that we create an inclusive and safe environment for the students that we're training that will then translate into professionals in the future. Role clarity is another big one, especially when you're working with different teams. It's important to understand your own role, but also the role of those individuals that you will be working with. The better you understand them, the better you're able to work effectively together to solve the problem, and or be able to refer out if that person or profession is not on your team. From an interprofessional education standpoint, really what this does is it also helps to develop professional confidence in who you are and what you're able to do, and really refines those scopes of practice in which are set, as well as some of the other things that you're trained to do. But then you see where the role overlaps with different disciplines and also diverges to help really clarify how you can best help the client as an individual member of the team as well as a team member. And I think it's important to call out that the research highlights that the stakeholders all need to be included. So that includes learners. The patients also need to be educated, the population, and providers, whether those providers are faculty members or those providers in the community helping out. So as you can see, interprofessional education has 4 core competencies, and these 4 core competencies have been outlined by the Interprofessional Education Collaborative, which is a coming together of different professions to help highlight the need for this interprofessional education drive in higher education and beyond. And so you can see why I might have been excited when I saw Tracy's call for the Ethics Fellowship last year during the pandemic. As you're sitting around, I thought this would be a great time to intentionally deliver some effort to this values and ethics core competency. For the last 3 years, I've been teaching the Health Science 5100 1 credit Introduction to Interprofessional Education course that Marianne and others had cultivated. And I will fully admit, be transparent, that the values and ethics portion of that course was likely the least padded, right? It had the least amount of substance, because you think, yeah, we're all professionals, we're going to act ethically. And truly, this experience has highlighted the values of ethics and how it can truly stimulate the critical thinking within students and faculty alike. And so these 4 core competencies highlight the sort of main segments that are identified within the model of the class in which I teach. And so at this point, I know that a lot of you have been introduced to interprofessional education, but I'm going to pause to see if there's any questions or points of clarification that are needed before I jump into the outline of what the course looks like and how I use ethics and infused ethics into that course. So are there any questions at this point? I'm going to say probably just unmute and ask if there are. Great, we're all professionals and now we're on the same page. So now that we all understand sort of the big idea of interprofessional education and why it's important, I'll jump into the design of the class. So this is the model for the Intro to Interprofessional Education. And as you can see, it's a hybrid course. And so it's taught over the course of 8 weeks at the spring semester. So the beginning to the middle of the spring semester in that first 8 weeks. And so it's a hybrid model in that we use the core competencies and the outline by IPEC to sort of drive these 8 weeks. And they're broken into 8 2-week increments, where 2 weeks is dedicated to roles and responsibilities, 2 weeks dedicated to interprofessional communication, both in the team and with clients and community members. The 5th and 6th week were dedicated to values and ethics, and 7 and 8 were team and teamwork. And so down at the bottom illustrates the didactic portion. So these are in Canvas. They are, delineate the key points that the students need to take away so they can absorb that knowledge. And then in the 2nd week, so for example, in the 2nd week of the class, we have implemented specific workshops so the students can truly come together in this collaborative space and work together. And so the case workshops illustrate this unfolding scaffolded case study approach, which is perfect for interprofessional education because it's giving clients or the students the opportunity to focus on the clients and sort of work through this process in a collaborative fashion while problem solving along the way. And so just to give you an example of what these first 2 workshops look like, This year we had 11 students enrolled in the class. And so you'll see the stats next, but those 11 students were divided into 3 groups. And so each group was given a different case study or a different client to work with through this 8-week period. And so in the first workshop, the team of students was presented the workshop, so the case. So they were given, who's the client that you'll be working with? What are the main concerns? And what's a little bit of background history? And the students come prepared to talk about that through their own scope of practice, using the literature to inform that conversation. And so you'll be introduced to the cases later on, and you can see how this develops. But the scaffolded approach works in the second workshop, which happens in week 4, is when the students are actually given a chart note of the individual. And so, for example, this year we had nursing students working with nutrition and health promotion. And so what the students were able to do is look at the way in which different professions assess the information they want to get out of the client so that they can continue care. And so we've seen that this provides a great opportunity for students to ask questions. So for example, as a health promotion student, you might ask to the nursing student, so what do these blood chemistries mean? I don't know what these lab results are. What are the main takeaways that we as a team need to know? And so the individual students are independently educating one another as a team, which is very helpful because sometimes that's going to be a better way for them to take that information. And because they're solving a problem, it's going to solidify that learning. And so vice versa, a nutrition student might be curious as to what are some of the exercise measures that the health promotion student was able to capture, or what does this quality of life measure mean within this intake form? So you can see this is a building scaffolded approach. And so this presentation will focus on the implementation of these ethical case studies that happened within week 5 and 6. And so the clients and the students stay in the same motion. So they're moving, they're growing together. And so I took existing cases that already were in existence and developed for this class and embedded an ethical dilemma within them to help spur those communication and strategies for the students before they enter the sim lab. And so the sim lab is sort of our culminating event where the students work as a true team with a client, in which Lynn and her team do a great job of arranging. And so this year it was held virtually. It gives the students an opportunity to work in real time with a real client that they've met previously and have grown in their knowledge base and awareness of what the concerns are, but they actually get to meet them then in that sim lab. So it's a little complex, but I wanted to make sure that everybody had a good sense of what the model of the class was, so you could see where and why that ethical case study was put where it was. So are there any questions at this point? Take that as a no. So I will move forward. And I just wanted to highlight who's in this class, right? Because the who is important. But so the discipline specifics that were represented this year are health promotion, because it is a requirement for our health promotion graduate students. So they're in the class always. We always have representation there. But as a result of my role at the Center for Active Living, we oftentimes have nutrition students who are embedded in some of our programs. We also have the community health nurses that are doing some of their practicum time there too. And so we've had a variety of other disciplines be involved. We'd love to have, social work representation. We've also had psychology represented. And so the bigger the groups, the more diverse those groups get, the more, creative we can get and learn about these other professions. But I wanted to just highlight who was in the group this year as we go through this process. So we had health promotion, nutrition, and community health nursing. So again, those 3 disciplines were grouped into 3 groups and given a specific case. And so over here on the right, you can see that these are the 5 primary disciplines that are represented within the College of Nursing and Health Sciences. I wanted to make sure that everybody was aware of the non-traditional partners that we have, right? So that mental model that typically goes to, interprofessional teams being made up of doctors, nurses, OTs, PTs, we can now transition to understand this is the opportunity that we have with our unique non-traditional partners of health promotion, nutrition, nursing, exercise science, and athletic training to create new dimensions and new opportunities for collaboration. And so, because we're all interested in evidence-based approaches and we want to know what's working and what can be improved, I've provided the evaluation measures that we use for this Health Science 5100, which is the Introduction to Interprofessional Education. We did a pre-post test of student perceptions of IPE using the SPICE R2 tool, which is great because it highlights overall perceptions, but then it's a 10-question tool, and there are questions that are associated specifically with teamwork, roles and responsibilities, and outcomes. So you're able to capture those different areas of interprofessional education. Because all of our sessions were done synchronously through Zoom, we were able to record those, and some of the quotes that you will see were pulled from those class discussions. In addition, we used faculty feedback from the different case studies, as well as the ITOFT, which is a specific measure used within interprofessional education to guide teams and teamwork. So those measures were used to pull out. Because the literature recommends that reflective processes are essential to interprofessional education, learning, and growth, I embedded 2 reflections, one after the ethical case study assignment that the students were given, and I also had a final class reflection. And so some of the quotes that you'll see later on are pulled from that to help us better evaluate what's working, what the students got out of this, and what might we be able to improve as we move forward. So because we are modeling an interprofessional team, we want students to feel comfortable in this space. I wanted to give a special thanks and also highlight these individuals from different disciplines who have helped with this class over the last few years, helping to put together a lot of the material, but also give feedback to the students. I think it's important that we represent an interprofessional team as we're working with them so we can model that. And so, you know, we're a pretty close-knit IPE team, and I want to give a shout out to these individuals. And then specifically to Debbie O'Connor when it comes to the ethical case studies. I wanted to intentionally bring in different disciplines as we develop these case studies to make sure that they were relevant to different populations. We were capturing actual ethical dilemmas, etc. And so I just wanted to showcase the fact that, you know, we are an interprofessional faculty team working to educate the future workforce and these disciplines that are involved in this 1 credit course class. So that's the basic model of the 1 credit course interprofessional education class. But now I want to specifically look a little bit more in depth into the case studies. And these case studies have had a long history, and I think context is important. And so the Lane Center was opened in 2016, I want to say 15, 16. And so Lynn Phillips, Sarah Qualls, and Marianne Kluge all worked together to develop a group of case studies that help students navigate and become more familiar with chronic conditions, intentionally embedding areas of the diversity, inclusion, and equity, as well as just complex situations to really make students think about this. And originally these were used as opportunities to bring students together in the sim lab. And so after watching some of these sim labs occur, I was thinking, as I was then given the permission and taking on that 1 credit course, to be able to embed these case studies into the class so that they build on it. And so the classes ebbed and flowed over time with the help of that faculty team. And so I think it's important to know that these case studies were originally already developed, and so they were adapted to fit within this class, but they really showcase the different opportunities that community members could have who might be served at Lane. And so each of these case studies has different dimensions that represent the different clinics that are in the Lane Center. So there is, you know, a report from the Aging Center. We have Veterans Health and Trauma included. We also have the primary care clinic, Peak Nutrition, as well as the Center for Active Living. And so we use those to help shape these. And so you'll see that there are several layers yet again, but it helps also to prep the students to then be able to dive into interprofessional opportunities that are existing within Lane. And so the case studies that were used this year that now have an ethical component to them are the case of Mrs. Smith, Mr. Washington, and Mrs. Portillo. And so we will dive a little bit deeper into each of these cases so that you can see what the students are needing to navigate and how they're able to negotiate these skills moving through. And so first, now we're diving into the specific ethical dilemmas that were created. And this is where a lot of learning for myself occurred, right? Again, sometimes we think that ethics is something that's easy. It's like, yeah, I've got a good head on my shoulders. I'll make the right decision. But after I was awarded this ethics fellowship, I really took this seriously and took some time to investigate what are some ethical dilemmas. And there's plenty of ethical dilemmas that exist within a sort of physician model within hospitals, but I really wanted to make these pertinent to the non-traditional partners that we're working with. So I drew on theory. I even asked some of the participants that were engaged in the Center for Active Living programs, such as Parkinson's Wellness Recovery, diabetes prevention, and our worksite wellness programs to get their experience. What are some ethical dilemmas that maybe you have encountered or you know about? And then triangulated that with the literature to really pull these together to make sure that they're complex, they're accurate, and meaningful to the students. These might be things that they face. And then again, vetted this with the interprofessional team of faculty, as well as, compliance and some of the other clinics that exist in Lane to make sure that they have value. So these are the areas that were developed in working with these case studies. So now I'm going to introduce the ethical dilemmas that were created to fit within those case studies that were already embedded in the interprofessional course. So first, we'll start with Mrs. Smith. So Mrs. Smith is a 74-year-old Caucasian woman who's been diagnosed with Parkinson's disease. She's had this diagnosis, but in addition to that, she also has hypertension, depression, and she lives alone, according to her chart notes. Recently, Mrs. Smith has been participating in the Power Moves exercise classes at the Center for Active Living. And so she is entered into the Lane Center in this interprofessional care because she just wants to better understand what her holistic health looks like. And so that's an introduction to Mrs. Smith. And so the students would have gotten to know Mrs. Smith both at that first level, just the introduction to the case, and then before introduction to the ethical dilemma, they would have looked at her chart note and talked with the team about what that looks like. And so the ethical dilemma that existed with Mrs. Smith was that this idea of the client remains at the center of care. However, sometimes providers have opposite feelings and feel as though a client needs to do one thing, right? And so the ethical dilemma existed in negotiating and being able to work together as a team to figure out, Mrs. Smith clearly delineates within this ethical dilemma that she doesn't want to see a shrink or one of those social people, alluding to the mental health professions. She was very much against it. However, in the first two case studies, the team saw that probably a appointment being made with the Aging Center would be a great next step for Mrs. Smith. So this presents that ethical dilemma as an interprofessional team, you need to keep the client at the center of care, even when your wishes as a provider team may be a little bit different, and being able to manage that and negotiate that. The second layer that we threw in with this ethical dilemma was family relationship tension. So this was obviously set in 2020. And so as a result of COVID, Mrs. Smith's son had moved back to, help her out with things around the house, give her some social support, because as we know, isolation is a huge thing that happened within the COVID pandemic. And so the family relationship tension highlights the need for understanding scope of practice of the different disciplines that are at the table. And so within this specific team, we had nutrition, nursing, and health promotion. And so the team needed to discuss whether or not it was within their scope of practice to be able to identify sort of these palpable tensions that existed between Mrs. Smith and her son, or is that somebody that needs to be brought in to be included in that team, or a referral that needs to happen? So these ethical dilemmas that were embedded to each case, the students were given the ethical dilemma and had 2 weeks to work together as a team to solve this problem and identify their next steps. And so within this is what the Mrs. Smith group was presented with. And how do you navigate that, and what are your next steps? Next is Mr. Washington. So Mr. Washington is a 57-year-old African-American male. He recently suffered a heart attack, and the student group is meeting him as he's transitioning from his cardiac rehab, and he's looking to make lifestyle changes. Interestingly, Mr. Washington is also an employee of one of the employers or organizations in which the Center for Active Living does their employee worksite wellness programming. And so there's a little bit of information that the team is able to gather from that, knowing that he has the opportunity to engage in personal training if he would like to. The organization will also pay for him to do group fitness classes, meet with a dietitian, attend cooking classes, or even educational situations. And so they feel like this is a great opportunity for Mr. Washington. And the ethical dilemma comes in, again, using that social ecological model to help model this. This is less interpersonal than Mrs. Smith's case, but more as an organizational dilemma that exists. And so the question is, Mr. Washington works the night shift, and employees who engage in this worksite wellness program are given a large discount on their insurance if they participate. However, as a night shift worker, he doesn't have the opportunity, as much opportunity to engage in these opportunities as those people who are working a traditional 9-to-5 job. And so the ethical dilemma that exists here is, this idea of equity versus equity. Equality versus equity, right? He may have the opportunity to engage, but the opportunity for engagement is not equitable amongst all the employees. And then the other one that comes up is the fact that Mr. Washington he would be required to engage in a biometric screening as a result of this program to get that discount and to live a healthy lifestyle. However, because he's just suffered a heart attack and is going through this identity shift, he asked the question of, who determines what's healthy anyways? They're going to tell me that I'm not healthy. Why do I want to be, told that over and over again? And so from a health promotion and a public health standpoint, I think this is an important question that the students understand and navigate, right? Who determines what's healthy? Is it the government? Is it the individual? Is it the organization? So these are some examples of the conversations that came out of this ethical case study with Mr. Washington. Moving forward to Mrs. Portillo. So Mrs. Portillo was the third and final case study that was embedded within this ethical dilemma. And so she is a 51-year-old Latina female who has recently just started seeking care from her primary care physician. According to her chart note, she has uncontrolled diabetes, sort of ebbs and flows between prediabetes and diabetes, also has hypertension, neuropathy, and depression. However, the students learn in this further along that maybe that communication isn't very clear because she doesn't actually know that she has uncontrollable diabetes, which goes into this conversation and makes it necessary for health literacy to be highly it's just an important thing for the providers to do, is to highlight that health literacy and make sure the client is understanding of what they've been diagnosed with. Mrs. Portillo also lives in a rural area in Colorado. Her husband works a lot and she has two daughters that are gone most of the time, but also require a lot of work. And so Mrs. Portillo's ethical dilemma actually exists more at the policy level. So it's not so much with her specifically, but what the interprofessional team that was given this ethical dilemma had to do was they're a team, and they are asked to go into the medical records that exist and identify clients who could be referred to the Center for Active Living's diabetes prevention program by looking at A1C values and other characteristics. And so the team goes in to the EMR and they find out that there is a group of patients who would have been fully a great candidate for this diabetes prevention program. However, they were not referred, and rather a provider who has recently left was seeing these patients on a weekly basis very regularly and billing for a code that would have gotten, $150 per session as a reimbursement amount. And so it's this idea that the provider was not specifically identified as a physician or an NP, but those are the gaps in which the students had to ask. The provider was seeing these patients more regularly rather than referring them to a community-based program. Whether or not there was outcomes, the students could tell that, Mrs. Portillo still was in a diabetic diagnosis. And so maybe these visits weren't necessarily helping with that. And so was it ethical that provider was recommending these people come over and over again, rather than giving the opportunity for a community opportunity for engagement? And so the second layer that came with this one is that as a result, or within the last year, the team realized that they had increased their amount of money that they were bringing in. And so as a result, they were able to hire a new medical assistant part-time that was able to free up time for more interprofessional collaboration amongst the providers and the team. And so the dilemma comes in that the students then have to navigate. So potentially the money that was generated to be able to hire this new MA was generated from those potentially unethical visits by the provider who has left. I do want to put a disclosure here that these are no way, shape, or form tied to the Lane Center or any of the healthcare services that are going on. However, within the literature, these are some of the trends and patterns that are coming out of, how do you train students to think when these types of ethical dilemmas may present themselves? And so that's a deeper dive into each one of these cases in which the students had to navigate and negotiate. And so just to give you a better idea of what the actual assignment was, is that, this is it in that third level, that third time frame, looking at values and ethics. And so the students they'd already been introduced to their client, looked at the chart note, and now they're given an ethical dilemma that revolves around this case. And so they had to work as a team to identify the ethical dilemmas, and then they were asked to apply the tools that they were given. One of those being the Daniels Ethics Fund principles, the Interprofessional Education sub-competencies of values and ethics, as well as the Reed's interprofessional decision-making model. And so the students were using those, and then they were asked to do a presentation at the end to highlight which one of those was the most valuable to them in helping, solve this problem. And so after that, the students were also asked to use at least 2 peer-reviewed articles to help support the rationale for the direction in which they were going to go as a team. And then they were asked to identify solutions and next steps in their presentation. And the idea behind giving a presentation is that the whole group was then introduced to these different levels of ethical dilemmas that could exist, both on that interpersonal or relationship level of the social ecological model, also the organizational level, as well as the policy level. And so this was using problem-based learning theory to help students put into real life situations, this ethical dilemma to solve them. And so what we found was really fascinating through not only the pre-post examination of that SPICE R2 model, but also the qualitative data that was collected. And so these are the results from the students the perceptions pre and post, I will highlight that only those students that were required to take the test or the class filled out both pre and post surveys. So I wanted to highlight that these are just the viewpoints of the health promotion students. I do have pre-post scores, but these were the only ones that really lined up. And so I wanted to highlight it, and this may be more specific to health promotion than the others. It was interesting when looking at the overall perceptions of health promotion, nursing, and nutrition. Nutrition actually had the highest original score in the pre-test, whereas health promotion was right in the middle, and then nursing was actually at the bottom. So once again, these are very small numbers, so I'm not sure really how much to take into account. But what I want to show here is the fact that this SPICE R2 metric is used, and it is able to break down into teams and teamwork, roles and responsibilities, and outcomes. And when looking pre-post at this evaluation that the students took, the teamwork was the one thing that increased. So the roles and responsibilities decreased as a result of the fact that students realized that they didn't know as much about the other disciplines which they could work with as they once thought in the beginning. And then the outcomes are associated with the cost. So one of the questions asked, does working in an interprofessional team help to reduce healthcare costs? And, they were unsure that that would be the case because of the extra time and effort. However, that wasn't a core focus of this class, given that it was an introductory class. So main takeaway here is that teamwork was really one of the salient perceptions that had increased. So they felt as though their teamwork had increased. And in one of the questions specifically, it asks, do you find health or interprofessional education valuable? And that was specifically highlighted as a yes, and was highly rated, which is important to know that they value this process. And so this is the qualitative takeaway. So again, the student quotes were pulled both from class discussions, they were pulled from ethical reflections, as well as the overall class reflections. And so the Daniels Ethics Fund principles really allowed the team to build a foundation across the different professional backgrounds. It was sort of their grounding spot. They were able to use that as a foundation to then start these conversations around these complex ethical dilemmas. The ethics module was really when things began to click. Some of the students saw that there were shared values and ethics when working with other professionals. Others learned to speak up, showing that they, felt as though those team dynamics were growing enough where they felt as though they could speak up versus being quiet and letting others lead the way, which is indicative of a growing team through the process. And then another student highlighted in the final reflection that ethics really brought together the class. And then some of these faculty quotes are taken again from conversations that we had post-class discussion, the ITOF survey, which was identifying growth in teams and teamwork, and just, little excerpts. And so the students were becoming aware of things that they didn't know. I would say that's a pretty big takeaway. And being able to ask the questions is another thing that they were really able to do to get clarity on what was the direction they were moving. Another faculty member said this is a keeper, also a potential option for other courses to implement something like this into the classes to increase interprofessional collaboration. Another student said that the Daniels Ethics Funds were clearly applied in helping the students to work together. And then this last quote highlights that shared decision-making was something that occurred, which is if you look at the sub-competencies of the IPEC teams and teamwork, that's something that is necessary for teams and teamworks as a checkbox, right? Again, it's this idea that is a shared mental model and they're making decisions as a team versus talking about it, but then making independent decisions, which sometimes can happen on a multidisciplinary or an interdisciplinary team, right? There's a need to distinguish the difference between multidisciplinary as well as interprofessional. And interprofessional is that you have that shared mental model and work collaboratively for shared decision making. And so those are evidence that teamwork was grown from this class, but specifically that ethics played a huge role in it in helping the students understand it. So in conclusion, it shows that ethics can be a catalyst for IPE and teamwork. And it's the fact that ethics, especially the Daniels Fund principles, which were highlighted by the students, we're able to bring them together and use this as a foundation to talk about their different perspectives and therefore reinforcing the roles and responsibilities, reinforcing interprofessional communication, both together and with the client, and helping them move into this collaborative practice format and feeling more confident in doing so. And so this image just showcases this process improvement that ethics has been able to provide. So these students feel more confident and they got more comfortable with their group and that they were able to speak out. They were able to share their different perspectives so that the client was able to get that circle of perspective and receive a holistic approach to health. And so in conclusion, as faculty members, staff that are helping to support anybody who's in education, right? Our goal is to educate the future workforce. And so the improved populations, the satisfied providers, the reduction in healthcare costs, while keeping the client, the community, and population at the center of care is huge. So working towards this quadruple aim. And finally, ethics was a huge part of facilitating interprofessional education and teamwork. But on the flip side, I think it's really important that we recognize that interprofessional education as a part of our goal and our job is actually ethical. Clients, communities, and populations require and they deserve to have a holistic approach to healthcare so that they get the best possible outcomes. So that is all I have. Here's some references. If anybody's interested, I'd be happy to share them. But at this point, I would love to stop the presentation and potentially have discussion. Are there any questions?
Great job, Paige.
Thanks, Jackie.
It was great. I love how it all comes together. Well, one question I have that I always get asked about or I read about is the difference between interdisciplinary and interprofessional, because I think sometimes there are people who use those interchangeably and they probably should not.
Yeah, I think that is a great question and something to be highlighted, right? Both are valuable, interprofessional and interdisciplinary, but the main difference between the two is when you're working on an interprofessional team, you really are interlocked, right? Every move is team decided and it's not, talking about it, but then going a different way and providing that. So interprofessional education and collaboration is truly a team effort where you are dependent on one another. There's a shared leadership model. So there is no one leader all the time. It sort of ebbs and flows. And so it's interconnected. Whereas in an interdisciplinary or multidisciplinary team, oftentimes they're co-located, but just because you're co-located doesn't mean that you're going to make shared decisions, right? But, it's great to have them down the hallway to say, hey, what are your thoughts on this? But it really comes back to using the provider's autonomy to then make decisions. So for example, a dietitian, registered dietitian might ask primary care for, thoughts on this situation, but yet so it's more interdisciplinary in that they're getting the thoughts and perspectives, having those conversations. But in the end, it's the autonomy of the registered dietitian to make that opinion on where the care goes. Whereas if it were interprofessional, they would be sitting around a table discussing this with a model moving forward. Does that help?
It helps. Thanks.
Yeah. Yeah, Judy.
I would add to Jackie's question because I used to think that my physical rehabilitation team was truly interprofessional until I realized there was quite a power and equity around the table. We always started with a physician, psychiatrist, and then we went down all kind of like the pecking order. And when really things are truly interprofessional, it's a flatter structure. And so I've learned that from my participation over time, how to better define that. I just wanted to throw that in.
Yeah, thank you. I think that's a great example because those hierarchies are something that is oftentimes discussed in the literature and we can see it in every day. So thanks, Judy.
Hi, Paige, can you hear me? Can you hear me? This is Helen. I was trying to get my hand up, but I couldn't find the little icon. Sorry about that. But anyhow, great presentation. And I want to tell you, I, as a faculty member in nursing, I really benefited from the discussions you had after the students were there. The students had talked and shared with each other. You had faculty come together in those little Zoom rooms, and they were so beneficial just to hear the faculty from the other disciplines and their comments on the ethics piece as well too. So my question for you is, moving forward, how do you plan to implement ethics into your other courses in the future?
Great question. And yes, Helen, Judy, all of you who are on who were helpful. I mean, we all learned a lot, but to answer your question, Helen, I think, within the Center for Active Living, we have a lot of different outlets. So not only do I teach the 5100 course, but I also teach project management, also oversee some of the interns that are coming through. And Bryn and myself are going to be putting together a internship prep class. And so I think there's a lot of dissemination points for ethics. And even I've seen the conversations because it's been at top of my mind, even talking with the interns, I've seen these conversations come up. And so I think direct implementation will come in this prep course, specifically identifying that working with these populations, working with community partners in an internship, you need to be aware of these ethical concerns and just being mindful and growing awareness on your own. Project management absolutely has some ethical guidelines. And then I think in addition, because I have the opportunity to connect with community partners, I think some of this will translate hopefully over to them. And I think, using those community partners to form some of these ethical dilemmas, they've asked me, how's it going? What'd you come up with? So I think those are specific opportunities.
Super, thank you. Excellent strategies.
Thanks, Helen.
Well, so if there's no other questions, we can conclude. And I'm sure that we'll be sharing the video and the PowerPoint. So thank you so much, Paige.
Well, thank you. And thank you, everybody. But honestly, Tracy, this has been a great experience. Just, if any of you haven't done the ethics fellow, I would highly recommend it. I mean, from a critical thinking standpoint, it really challenged me to think outside of the box and then being able to translate that to meaningful experiences for the students. I mean, I really enjoyed it. So thank you. Thank you, everybody, for coming to the presentation.